Good evening, viewers. This is Health Up. We're happy that we're here discussing much about our health and empowering us with information and with knowledge, and looking forward that you're going to make and we are making a difference in our lives as we proceed on with this. Thank you so much. My name is Onesimus Mogo, and I'm going to be a host tonight, coming to you from the Oak Medical Center right there in Thika, and we are happy to be here. My guest tonight is Eunice Masharia. I'm going to give her an opportunity to introduce herself. She's a reproductive health expert. Let me give her the opportunity to just introduce herself as we proceed on. Yes, karibu sana.
Okay, thank you, Onesimus. My name is Eunice Masharia Wamboi, a clinician with a specialty in reproductive health, working within Kiambu County.
All right. Thank you so much, Eunice. We are happy to have you tonight, and we believe that this is going to be resourceful as we proceed on with this particular discussion. Maybe as we introduce the topic and what you're going to be discussing tonight, probably you could also tell us, when we talk about reproductive health, before we go to the issues we're going to be discussing tonight, what do you exactly mean when you say reproductive health expert or reproductive health specialist? What is all this?
Or the reproductive health specialist basically is what we call the obstetrics and gynecology. That's what most of the people are familiar with. And it entails managing issues that pertains to pregnancy, issues that pertains to reproductive health in terms of gynecological conditions.
All right.
And of course, we have reproductive wellness.
Okay.
Yes.
All right. That's good. So, Avio, welcome so much. We're going to be discussing and looking today about menstrual hygiene and menstrual health. I believe you're going to be empowered, with this. Now, as we just move on to, this particular program, one of the things probably would want to, to bring to our attention, as also engage the guests, is that this is a very important topic, and I believe our guests tonight, we are going to be able to bring out this, because quite a percentage, when you look at, statistics, over half, 50% of some of the ladies or young girls that are getting into puberty, getting into experience issues with menstrual flow, have no, basic understanding of what, this entails and all this is all about. Again, you're also getting quite some high percentage, some recent study that showed about 10% of some of these girls are getting into early menarche, and education and awareness and about these particular issues and matters and how to handle ourselves or how to handle themselves is basically still a challenge, or still not in their own, they are not aware about it, and we need to bring out this to the community. So this is of a public health interest. We want to empower the children, we want to empower the young girls, we want to empower the parents to all this. So probably, just beginning there, if you can put in some more input, I guess, Eunice, why do we need to talk about this menstrual hygiene or menstrual health rather? Maybe broad menstrual health.
Yeah. I think one of the basic thing I would say of why it would be very important to talk about menstruation or menstrual health, one, it is a normal process in life.
Yeah.
And it is expected that every girl eventually will get their menstruation. So, and we only have few exemptions. And that means every woman, every child who is born, eventually will experience a menstrual process. And it becomes very important to understand what is normal about it and what is abnormal about it, and even how to carry on with it, because it comes at a point of puberty. So most of the young girls, as they're growing up, they know nothing about it. They start hearing it at some point. As they grow up, they get to a point where now they experience it. And they need to know, again, once you experience it, what is normal and what is abnormal. Yes. So and how can that be addressed for them?
And how can that be addressed?
Yes.
So these are the issues we're dealing with. So probably when you talk about, there's something you talked about puberty, and that these will begin to develop when one gets into puberty.
Yes.
What is this that we are calling puberty, so that now we can be able to see, to proceed from there? Yes.
Okay. When you talk about puberty, is where we have the transition from, in terms of reproductive system, for both boys and girls. And this is where now they get from the point of childhood and they get to a point of adulthood. It's that transitional period where there's that moving from a child state into and the development that comes at around puberty is of reproductive health changes.
Okay.
Because the ears will develop, all the other organs of the body develop as they are.
All right.
But reproductive systems, they get to a point where they change from that of a child to that of an adult.
All right.
And that transition between that movement is what we call the adolescent or the teenage.
Okay.
Yes.
So this puberty, you're saying, what causes some of these changes? What is when you talk about that this individual is going to be changing on from, from a child, to a teenage, and to an adult, ultimately, what are some of these things that bring about these changes? And probably other than, the issue of menstruation, do we have other things that are change,
Yes.
within the body, that can be associated with what I'm talking about? Yes.
All right. Yeah, the changes at all, basically what happens, it is all about hormones.
Yes.
And there's the androgen gets more stimulation when they get to the age of puberty. And basically the age of puberty can start as early as 8 years for girls and can start as late as early as 9 years for boys. But it ranges from there to about 15, 14 years. But it can come that early. And when the hormones changes come,
Absolutely.
there are definitely changes that also comes to the body.
Yes.
And this young person will observe those changes. And primarily the first change that comes, it is the banding of the breasts.
Okay.
They may not really grow. What you're going to notice is a girl is that the breasts start getting some budding, because all of us, boys, girls, they all have breasts.
Yes.
But at the point of puberty or adolescent, that's when now the girls start becoming different from that of a boy. And you find there's that banding. After the banding, we call that puberty. After the banding of the breasts, it is later followed by development of the pubic hair.
All right.
And also the hairs on the axillary areas.
So you're saying that different body parts
Different bodies have
actually
different
changing,
changes.
and there are different changes. So there are changes
Yes.
we are seeing, within the body structure. There are changes we are seeing within the breast. There are changes we are seeing, we're talking about pubic hair, axillary hair.
Yes,
There are
yes,
basically
yes.
all these type of changes.
All those
Are there
changes.
some emotional changes that also do take place?
Yeah, of course,
within-
teenage has also the other things. And maybe to say after all those development, even the pubic hair, now they also get their menstruations.
Oh, okay.
And for most of the people, at least when the menstruations come, it looks like it has now matured the adolescent aspect for a girl.
Yes.
But in terms of what you're asking, the emotional aspects, definitely when these hormones are setting in and the changes that comes, it comes with some psychological effects. It comes with emotional effect. And definitely the psychological and emotional effect will also affect their social life
Okay.
at a bigger picture because of the changes that are coming with adolescents. And one of the things that happens, they start becoming more aware of themselves in terms of sexuality. The girls start realizing, I'm a girl.
Yes. Yes.
I don't look like my brother or my cousin. That's the time they start now.
I no longer have a flat chest.
Yes, and
I
they
mean,
start becoming conscious about it.
Yes. And aware
Before they
sometimes-
could
yeah.
see, yes, we don't look the same. But at this point, they start becoming conscious about it, and they feel like, no, yes, this is not a private part for me,
Yes.
and I need to hide it. So they are more conscious about their genital growth. The other thing, they also, and their sexuality. And of course, the other thing that comes in is, especially for girls, because that's where we have cyclic changes within the menstruations, the puberty, you find they get emotional effect much more. And they get to a point where they are happy and excited, then easily get offended,
Yes.
they get annoyed. Then generally at that point, all teenagers, they feel above, on top of the world.
They know everything, they are
They
coming.
feel like know everything.
They don't need more advice. They are no longer children. They are no longer kids.
Yes,
All right.
yes. So you find at that point a lot of, besides what is going through their body, in the society, there are also so many other effects.
Have so many other effects.
Yes,
coming out them.
are going around them. And again, of course, they're coming from families, and sometimes it does not go well when they look like they know so much, yet the parent know more than them, but they want to act like wewe hujui, sisi tunajua.
There's something that you just mentioned as you are talking,
Yes.
and you said sometimes we are getting these children, if I use that word, transit from childhood into early teenage,
Yes.
early alone in life than we, than it was actually before.
Yes.
So do you think, or what would you say about this kind of transition? Because some studies have also shown that approximately a small percentage, well, not small percentage, but about 10%
Yeah.
of some of these girls are getting into, they are developing sexually, even coming to the age of, to the time of menarche, which are going to, tell us, more about it, earlier on in life. What would you say is really contributing to this? Because this age group is not necessarily what we used to have, before as it were.
Okay. I think one of the things that happens, in as much as it is something that is happening with the body, there is also a lot of environmental factors that influence the development of a teenage.
Yeah.
Starting from the diet, what they are feeding on.
Yes.
Yeah, like for the period to start, there is a certain percentage of the body fat that is required. And I think it is more common on the children who are maybe coming from urban than the rural setups. Yeah, okay. Because you find the children in the rural setups, they're more active, burning a lot of fat and all that. So you may find their puberty setting, especially when it comes to menstruation, much later compared to those in the urban. And again, you find most of the ones that have a bit of higher BMI, they're likely to have their menses much more earlier. However, that is not exclusive, because we have others with different BMI and all that, and they have their menses early.
Okay.
But one of there are also, besides the physiological part, there is also the environmental factors. Yes.
All right. So when you say, when you compare these rural, setups, you are probably telling us that some of these children, do some extra manual work, they are more or less more engaged in physical activity, when you compare that with urban setups. When you talk about diet, what do you think, or what did you say about this diet in rural and urban setup that seem to have, a relationship with how fast or how, soon that these particular girls develop?
Okay, we may not necessarily say rural urban, because again, feeding is issue of family and all that. Yeah, but again, you find if you want to go that way, you would look at it that in urban there are more junks, which have more fat deposition compared to the rural setups.
The rural setup.
Yes.
Okay.
Yes.
Now, when you talk about boys and girls, just before we move from that point, are these developments that are taking place within girls, are they also happening to boys, to young boys?
Yes, even the boys have their development at that particular point.
Also hormonal related?
Also hormone related. That's when the testosterones become more active, and they start the production of the sperms, and they also have the physical body changes. Rarely do they have emotional changes, but they have the physical body changes, the boldening of the shoulders. And of course, what happens to the young girls, you find they also have the figures.
Yes.
That's when they start developing the figures, the one figure along the hips.
Yes.
For the boys, they get a lot of fat deposition on their shoulders, and they become the masculine.
Become masculine. They feel that they are the men of the house.
And they are the men of the house.
Something has changed, the father, there is another one who has just arrived.
Yes.
They are developing. They are changing.
The voice
becomes
hoarse.
Yes.
Yes.
Now,
and they also become aware. They are more aware about themselves. They realize, this is my sister, this is my cousin girl, and I should not do 1, 2, 3. We can't shower together, and that kind of changes. And of course, that's the time they start writing notes to.
Okay. To the member of the opposite sex, to some that they have something to express from
I
their
think
hearts.
now they are writing SMSs.
The days where the letters used to be written are just over. Posters are not very much operational. All right.
Yes, but that's the time in earlier age where you'd find a note in your book. Somebody borrow your textbook and return it with a small note, just bringing in some expressions. There's some messages being portrayed, which are also supposed to just give a feedback. Yeah, because they get that attraction to the opposite sex. And it also happened to the girls.
My concern is to that parent, who has, these children growing and they are almost teenage, going into teenage. And, they're just about that time where secondary sexual characteristics are beginning to develop. What message do you think because with all these things that we are saying, you know, and the changes that are taking place, and the preferences and the emotional issues and changes that are taking place, mental issues, you know, some of them becoming shy, it's a time now to change, you know, you can no longer sleep same bedroom with your sister and all that and all that. What message would you have to that mother and that father, you know, who has these children growing around them? You know, and how would we prepare for this particular age group as we receive them, because these children are growing?
They're growing definitely.
Yes.
Yeah, I think one of the things that I would say is that despite the fact that they have their own issues, which sometimes don't augur very well with us as parents, or the people who are there, the caregivers with them, we are the older ones, and we are the ones who are supposed to mentor them. We need to educate them. We need to guide them. And much more, understand what they are going through is physiological. Because again, if something is not handled, most of them, if they are not handled well at that point, they are likely to go in a very aggressive way, and they can either develop or underdevelop, or get even in very strange behaviors when they are trying to identify themselves. If they don't feel understood at home, they are likely to venture in other areas where they are likely to feel understood, accepted, and loved.
You know, where
that time they are not measuring the love with love. You know, for them, love will come in very many. They are differentiating it in very many ways. Yes. So if as parents, if you don't become conscious about that, they are likely to be offered that, and they will go to other areas in seeking for love and acceptance. Yes.
Right. So we are saying that we need to be conscious. We need to be deliberate, you know, about how, you know, that these children are growing, and we need to take specific actions so that we also have them. And this also will reduce, when you say that they also go outside, you know, and probably try to get some of these, you know, needs met, whether emotional or physical, outside there. It also means that we're also exposing them, you know, to other ills outside there. We don't want to expose them to early teenage pregnancies, you know, risk of contracting HIV and other STIs and these kind of things. Right? That's good. Now,
of course, you don't let them have their way.
Okay. There's a balance.
There's a balance.
So it's not whatever, you know, they ask that you just donate.
What they're thinking is life may not really be it, but they need you for guidance. And they will not remain teenagers forever. The understanding is getting better as the days go by. So you must give them good guidance. Sometimes you have to tell them no, but again with good understanding. Yes. Because again, we cannot just let them do. Yes, we have to guide them. Yes.
Okay. So the road has to remain, even if you know, in a different way, in a balanced manner.
Yes.
Right? I think that's useful. Now, when we go back to, you know, as we're discussing this issue about menstrual hygiene, because anyway, this is still part of you know, puberty and the changes that are taking place. There's something we mentioned along the way. We talked about, you know, MENAC. Probably the viewer would want to understand when you say early MENAC, when you also talk about, you know, menstruation, what do you exactly mean? Because it is not obvious to just assume that when you talk about menstruation, use these terminologies, you know, menstrual flow, you know, it's not obvious to assume that these are terminologies that are well understood.
Yes.
Actually, from a small study, there are few, or they are quite a very small number of girls that are actually comfortable to discuss, you know, about 12% to discuss these matters at home. So, you know, with their mother, you know, and well, with their father, that's possible, that's practical, you know, discussing it within the family setup, or probably with their older sister. And I'm sure we have viewers, you know, that are watching us, and they are, you know, following up this show, this particular program. So the issue of what is this that you're calling menstruation, what is that you're calling MENAC, menstrual flow, some of these terminologies, could you help us, you know, bring in a deeper understanding?
Okay. Yeah, as we have mentioned the word MENAC, and basically the word MENAC, it means the onset of menstruation. We have said this girl, from the time she's young, it will get a day when she's going to see her first menstrual flow.
Okay.
So when the first menstrual flow, when that flow is seen, that is what we call the age of MENAC. And many people will not even know its importance, but the doctors would always ask them at some point when they go to hospital, when were your first periods? Yeah, because there are a lot of information that we use from there. But many may not have even been conscious. But all the same, we're not asking you for the dates
And they
for
are,
the
you know,
month.
the details,
Yeah, because
the
we'll ask you,
nitty-gritty.
I'm asking you that when you're in your 30 years or something, yeah?
Yes.
But at least you can remember which year
Yes, which year it was.
it was,
Yes.
and then you know how old was I.
Yes.
Yes, because we call it the age of MENAC.
Yes.
That is the age when your first periods came.
Yes.
Yes.
Exactly.
Yes.
Menstrual cycle. What do you exactly mean? Just definition, just small.
Yes.
Just a brief.
So when that one first period comes,
Yes.
it starts giving us a cycle
A cycle.
for this young girl. And this cycle is that from that day, we are going to record the first menstruation.
Yes.
And the first day of menstruation, it becomes the first day of the next cycle.
Okay.
Because we call it, actually in the layman, we talk about monthly period.
Yes.
People talk about monthly period, like it's expected every single month.
Yes.
But when you call it menstrual, because it's not always, sometimes it will come every month, but you may find the duration it takes the same period. Eh?
Yes.
So after that, what follows, it is now, as I've mentioned, a cyclic thing.
Yes.
That will be happening. So a certain duration.
Exactly.
People have different durations. With the lowest days, number of days that a normal menstruation would come would be after 21 days.
Okay.
And the longest 35. People are different.
People are different.
Yes.
More than that, our viewers, you know, this is Health Up program, and we have this weekly show, and I'm glad that you joined us today. Down there are numbers that are going, you know, cross and coming and passing. Kindly, you know, interact with us. You can send in an SMS. You can send in a question through that, and we'll try and you know, answer your question probably at the end of the show through that particular SMS. And we are happy that you joined us. You can share also this. I believe you're also live on Facebook, on a social media platform, and YouTube. We're just discussing about, you know, menstrual health and menstrual hygiene. And at that point, whereby we're looking at, you know, what is this menstruation, MENAC, and all these particular issues. And maybe before we head on for, you know, for a break, I would want you probably to talk about a cycle. Are we talking of you know, a calendar month, you know, that you know, from date 1 to, you know, date 30? Are we talking of we always say it's a particular number of days, but what exactly is this cycle, and what are the variations that are within the normal ranges?
Okay. Yeah, as I have mentioned, everybody will have their cycle. So we are not using the calendar.
Yes.
In terms of January to December. We are looking at you as a person, me as Eunice.
Exactly.
What is my cycle? And I've said there are people who have a cycle as short as 21 days. Like after every 21 days, their periods will come. This person who have 21 days, if their periods come on 2nd of November,
Exactly.
by 22nd of November, they are likely to get also another menstruation, but that is normal for them.
All right.
So that's what I'm saying. It is not calendar
month.
but it is how many days does it take for you before your next periods come. Yes.
All right.
And I've said it range. There are some people who have it as short as 21 days, and it will go up to, there are people who have it as long as 35 days.
35 days.
Yes.
Is it possible for a particular individual to, you know, at some point that someone receives their menstrual flow after every 23 days, for example, after every 25 days, because we have given a range, or does an individual assume a particular number of days, or does it range within an individual?
It would range within an individual, and we always encourage girls and women to know what is my normal cycle. What happens initially when the menstruation starts, for most of the young girls, it takes maybe even 1 or 2 years before their cycle is well established.
Okay.
Yes. And some may go even for 2-3 months before their periods come again. Some will go to school and they will only come when they come for the holiday and all that. Especially the first 1 or 2 years. There are some who may have their cycles well established from the beginning, but there are those who may have it, they take a while without ovulation and their cycles are not regular. But after those 2 years or so, they're likely now to have a normal pattern.
A normal pattern.
A normal pattern.
Okay.
Yes. For majority, they will have a normal pattern, maybe after 2 years or so from when they started their menstruations.
So we are saying there's basically a variation from the normal, but with time there is some stabilization that happens.
Yes,
There's somewhere that an individual will get the flow, the cycle becomes stable in that sense.
Yes.
Right? So you are ensuring a mother out there, who has a child or who has this particular girl at that particular age, that sometimes there are variations within the norm.
Yes.
All right.
Yes.
And when you talk about menstruation and menstrual cycle, another term comes in, menstrual flow. What is this cycle flow? Are they the same thing, or is there a difference? And what is the difference if there is?
The difference when you talk about the cycle is the duration it takes before another periods come.
Right.
When you talk about the flow, when this period starts, how much of the amount is lost, or the bleeding that happens, because of course it flows as a blood. How much of it is observed? How many parts does this person have to change? That's what you measure with and all that. And again, you want to see how many days does it flow. Again, it also has a variation. There are some people who will, it ranges from 3 days to about 7 days. Yes.
Okay.
So there are some people who may have, by the 3 days, by the 4th day, it's adding. Others may go up to 7 days. And there are some people who may realize, for me, it has always been about 7 days.
It has always been about 7 days.
Yes. And that is still within normal for them. Yes.
When you talk about, the 3 to 5 days, are we saying that the amount of flow is the same, or are there also variations in that?
The amount will also differ
All right.
with individuals.
All right.
Yes. And that's why it's good for somebody to know they are normal.
Okay.
Yes. So that if there is any change, then you'll also be able to quickly identify your abnormal aspect.
All right.
Because if it comes for 3 days for you, then you start getting it 5 days.
Yes.
You start getting to 7 days.
Yes.
You want to seek for
For
help. For medical
yes,
help.
For medical
or
help.
some consultations. But again, you rule out other things that may give some abnormalities. Yes.
Is the same.
Yes.
All right.
Yes.
I think hold it there. Kindly don't touch that down. Let it remain elevate. We're going on for a short break. And then when we'll be back, we'll be able to see some of the other things and some of the other aspects as we continue more on menstrual hygiene. Kindly share these on your social media platforms, and we believe that is of a benefit to you. Thank you. Looking forward.